Welcome to another session. Dr. David Lee, pediatrician in Calgary, Alberta, is going to share his talk with us and some of the things that he's prepared for us and how he talks with his pediatric patients.
Okay, guys, ni hao, everybody. I just thought we could start off with something fun and light. And so I just wanted to start off with some popular cartoons in Vietnam that are kind of current. So, I thought we could just kind of go through it, everything, just like reading off my notes. So Peppa the Pig is not Peppa the Hale, but it's Hale Peppa. Then you've got Paw Patrol, which is Young Ju Jaw Gu Ho. And then finally, we've got Doraemon, which is a cartoon I never really followed, but it's about this is one of the most popular ones in Vietnam, and it's about a robot cat from the future who helps a boy who was oftentimes bullied. I think that you guys like. I'm gonna also just let everyone know that if there's a better way to pronounce it, please do correct me, because I can only read a menu in Vietnamese. So I never went to a Vietnamese school, so I'm gonna try my best here. Also, we have to put a little bit of gratitude to Dr. Ann, Chris's cousin, who did so much work and corrected everything and just really made things a lot more sensible, or the way that's said. So I thought we could just start off with some light ways of things you can say on the physical exam. So if you wanted to say like, hey buddy, you might just say chào em or chào cháu. If you want to say, hey cool guy, you can say something like xin chào cậu bé, dễ thương. Cool girl would be something, or hello wonderful girl would be chào cô bé, thật vui. You guys, does that sound about right?
I think it's tuyệt vời.
Tuyệt vời. Thank you.
Yeah.
Thank you, Grace.
Yeah.
So if you want to say give me five, which we can't really be doing right now, you can just say high five now. All right. And then if you wanted to say something like blow on that wall over there, you can say thổi vào tường đó.
Right. Is that how you get them to do the respiratory exam? You like blow out and like that's your cueing for them?
Keep it really simple. And I will also acknowledge that I'm gonna learn and probably try to take these terms only because I like to apply what I learned here.
Sure.
From this little research trip. Then if you want to say breathe all the way, you can just say thở hết sức, or breathe without any effort, or with no effort left, I guess. If you wanted to say something like make your belly soft like jelly, and it's kind of more playful, you can just say làm cho bụng cháu mềm nhớ kẹo dẻo đi nào.
Okay. It probably loses its the poetic rhyme is not as nice, I think, in Vietnamese, but that's a good thing even on as a cue though. I like that. Make your belly soft like jelly.
It's kind of like, I think that translates into a marshmallow, basically. Make your belly soft like a marshmallow. So,
right.
And then if you wanted to say walk with your toes pointing up to the ceiling, you can say đi 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 bộ với ngón chân của chỉ lên trang nhà.
Okay.
We're happy with that pronunciation there.
Cool.
And then walk on your tippy toes would be something like đi nhơn, đi nhơn, đi nhón chân, khiêng chan.
Yeah, I think that's the word for chung, right?
Chung.
Or that's how I would pronounce it.
So those are kind of some things we could say on physical exam just to prompt children. Then I thought we could just go over some kind of common diagnoses. So dehydration would be mất nước. For celiac disease, it's kind of very commonly discovered in childhood or screened in childhood. And so you can just say bệnh celiac. And another way you can tell people what that means is you can just say gluten sẽ làm không khỏe. And there really is no translation for a word like gluten. If you wanted to say that someone's face looked distinctive or unusual or atypical, I think dysmorphic is a bit of a harsh word. You can say something like khuôn mặt khác thường, which I think translates into unusual face. I guess no matter how you say it, it's going to always be harsh, to be honest. So
I think that sounds soft. It's like, well, it's not as usual. Yeah, reasonable.
A genetic syndrome, which I think we've covered many times, is bệnh di truyền. Leukemia would be bệnh bắt cầu. And then when I kind of break it down, it just means illness. And then leukocytes or white blood cells would be bắt cầu. I'm not sure why they have the word bridge in there, but it's the word for bridge. Go. And then mono is very interesting. It's bắt cầu đòn định nhân. And I think what it means is bắt cầu would be white blood cell, and then đòn nhân would be single core, which I think is the the mononucleus, like infectious mononucleosis. So kind of interesting how they translate that. Lymphadenopathy is sưng hạc bạc huyết, which translates into swollen ganglionic white blood. And what Dr. An told us is huyết is more of a Vietnamese Chinese kind of hybrid. So it's instead of saying white, like zhang kind of thing. So that was interesting. So there's a lot of influences about how Chinese Vietnamese influence from that word. Chicken pox is interesting. It would be Thủy đậu, and that's like Thủy is another Vietnamese Chinese word for water. So it's like water plus bean. At least this is my understanding. So I wonder if this is kind of the whole dew on a rose petal look. That the dew is like the water, and then the đậu is like something. Scarlet fever would be ban đỏ, and đỏ is like erythema. Fifth disease, or a parvovirus infection, that is where you would say ban đỏ nhiễm khuẩn. Does that sound about okay, Chris, to you?
I don't know. I don't know if I would ever even use that. It's nice that we have it, but it's like it's kind of academic.
Right.
Đó, nhìn, kung, something like that. Grace would probably be the best.
Ban đỏ nhiễm khuẩn.
Kung.
Ban đỏ is like the same. I think as you can see on the scarlet fever, ban đỏ, I think they use that for a lot of the erythemas, right? The infectious.
It's kind of like, is it like maculopapular?
Yeah.
That dog might be like an xanthan.
Yeah, so I use ban đỏ for all the xanthans, to tell you the truth.
Oh, nice.
Even, yeah. Because as you can see with rosacea soap, fat bang, like it's also bang. So yeah, so all the.
So what does bang mean? Is that just disease?
No, it's the rash. Like bang đỏ is like the.
Is
like
rash.
Erythema, like erythema.
Yeah. The erythematous rash in particular, I think.
Yeah, erythematous. Okay, fair enough.
Croup was interesting because croup, when you put it into Google Translate, there is no translation. So Dr. An helped us out with this one big time. It is viêm khắp tỉnh đường hô hấp trên và dưới.
Interesting. It's like infection in the upper and the lower respiratory tract.
Yeah. That's right, Chris. That's a mouthful.
Doesn't roll off the tongue as easy on the Vietnam emerge, I don't think.
And again, you punch it into Google Translate and you won't come up with anything. So there you go.
Maybe croup is just a made up disease by people in North America. Who knows? JK.
Yeah, it's the big dexamethasone industry.
Yeah.
big Dexa.
Big Dexa.
For neonatal resuscitation, we have Hoi Sơ Sin. So that means like recovery plus effort plus newborn.
Right.
Sơ Sin. I like to break down the words just because I find
very reasonable.
You build the building blocks to put the words together. Then we have birth weight. So you could the word for that would be gan nang sơ sin. So maybe you can ask like bé son gan nang sơ sin. Does that maybe that's not grammatically correct, but
I think it says what we need to, yeah. Gang nang sơ sin. How do you ask it, Grace? What's your phrasing?
Probably because the sơ sin is a noun, is an actual baby, right? So if you were asking that in a sentence, it'd be like, hồi em bé sinh ra chỉ cần biết cái cân nặng của nó bao nhiêu. I wouldn't, like in my day-to-day, I don't usually use sơ sin. I think you would use that if you were describing it to someone. How about Barney? Can I throw it over to Barney? Barney, how would you?
Yeah, so
I don't usually use that word sơ sin very much.
Yeah, no, me either. I usually just ask like, tôi nhớ khi mà em bé sinh ra cân nặng bao nhiêu hay là mấy ký. That's how I say it.
Yeah, I think that's more pragmatic.
Yeah, you literally ask them how much they weighed when you were born.
Yeah, đứa bé, like if you want more pragmatically, instead of saying sơ sin for any of those, I would just use cân nặng của em bé. Like I use em bé when I'm talking about their kid.
Mm-hmm.
Yeah.
That's what I usually use that as well.
Yeah, and that's what I say too. Because even this is interesting, like premature baby, like Jess and is that a phrasing someone would use?
Nong is right. So it's like hồi em bé sinh ra nó có bị sinh non không?
Okay.
But Jess and Nong is like extra adjectives like you might not need to use and you might forget anyways.
Or sometimes I say sun sum. I say that.
That's what I say too.
I say sun sum.
Yeah, that's right. Sun sum or sun no.
I say san dum ya hela sum hey.
Perfect, Chris. Perfect.
That's how I ask. It seems like more practical and less technical. Yeah.
Yeah.
Totally.
Yeah, because I think in everything there's like proper Vietnamese, and then there's more of your not slang, but more everyday use.
Colloquial.
Yeah, colloquial.
It's like more serviceable kind of thing.
Okay.
John is a slam dunk. It's yeah. All right, easy. Seizure would be like có giật, and then I guess yip just means like to jerk. And then for our northerners, we would say zat, có zat. By the way, I mean, Google Translate is very northern based, so everything with a D is with a Z.
Right.
Febrile seizure, we've got go ya so.
Yeah, so is fever.
Epilepsy would be like dong kin, which I think we've covered before. Dong kin. Hypotonic. And Grace, please let us know if this sounds, again, technical or if it's less used in every day, but
I don't think I even use it in English very much.
I've got here yam chung luk, or if we're from the north, it would be zam chung luk.
It says chung luk. Luk is strength. Look. So yam is like decrease. So all they're saying there is decreased strength.
For gross motor delay, we could say something like jam vung dong to, jam vang dong to.
Jam is slow. Jam vận. Oh, jam vận động. Jam is slow. Vận động is like activity.
Oh.
To is gross. Oh my gosh, that's a direct translation.
So is that even?
I don't even know if I would use that. Jam vận động to.
Yeah, I guess it's that like functionally, what are we trying to say? Because it's like we're just
you know
saying
what?
something is happening. The muscles are not developing in a way that we expect them to. Right?
So you can shorten jam vận động makes sense. I don't know.
And I think in if I was to hold a baby, I would just tell the patient or the parents, bé hơi yếu, just very weak. You is what I would just say probably, in all honesty.
That's what I would usually say too. I just say thấy em bé thấy hơi yếu, hay là hơi chậm, phát triển hơi chậm. That's how if I think they're a little bit delayed and I'm not sure, I say it could be, hơi phát triển.
Yeah, and that Barney, I think that would cover all. Like you can use that for that whole section. Like phát triển chậm would cover all your bases for the fine motor, gross motor, speech, and social, but and even global developmentally.
Oh, is this word this phát triển chậm? So that's what you're saying for developmental delay.
Yeah, and I would use it almost for any term. So like when I'm explaining to patients, I usually would just say, okay, so em bé 6 tháng thường mình thấy nó gàn nó thường mấy em bé 6 tháng thường nó gàn ngồi được. Cái này thấy nó hơi yếu, mình sợ nó phát triển hơi chậm. So that they kind of get a sense. So at 6 months, I would expect the baby to be almost sitting. I feel like he's a little bit weaker than I would expect. That's
they get it. If you say that, they get it. Yeah, because they use that a lot. And you say đứa bé này nó hơi chậm á. It doesn't matter chậm, whatever. They just say đứa này nó hơi chậm phát triển.
Or they break down chậm nói hay là chậm đi. They cannot. That's all they say. They stand late. They walk late. They seem to be speaking later than their siblings, and so. I don't break it down to gross or fine motor skill. I just use it. Yeah, I don't know the terms for it. I think that's probably why.
Yeah, except for like chậm nói, that makes sense to me. I don't know about social delay, but I guess even for you, like, have you even? We haven't gone through already, but like, do you delve much into autism in the Vietnamese community, David?
Yeah, we do. I totally forgot it to add that, but like cookie, yeah.
That might be kind of a good thing.
That's a good ad, yeah. Add autism cookie.
Okay.
And
cool, that's nice.
And you know what a good ad would be, like ADHD. I've totally, that's like all I forget. That's all I see. It must be mentally blocking it out of my mind when I go home.
These other things.
Yeah. But I'll for ADHD, I'll say if they're like hyperactive, I'll just say when why or
yeah.
Or if it's like more the inattentive type of ADHD, I'll say không có tập trung. Something I'll say.
So autism is tự kỷ, right? Am I wrong?
Yeah, tự kỷ for autism.
How do I approximately spell that? TU?
TU with the little U with the little hook, and then dấu nặng. Tự kỷ with dấu nặng.
All right, we'll let our editors come through that.
And it's funny, most patients actually understand what the gay means, actually, I find. Yeah, I think it's common enough, they seem to understand it.
It's very common in Vietnamese, like every Vietnamese person knows, like a lot of people know Thuki.
Yeah, like that. That's how I got the word, is from the patients. I said, what are you saying? And then I had to, okay. I said, what is it you keep telling me? Yeah.
So hyperactive, I would say like why
I don't even know how to spell.
Yeah, that's right. Anyway.
And how do you say inattentive, David?
There's no inattentive, but it's like không có tập trung, like they're not learning with everybody else. Is that something that you guys have heard before, or inattentive?
Yeah, I think it just means like they can't focus.
Another one is like không có khó để ý.
I don't know. Yeah. Okay. Cool.
Yeah, sorry for that. I forgot about that.
No, it's great. I'm glad this is why we're doing it dynamically, to catch some of the stuff.
I guess we'll continue. So for failure to thrive, I'll say something like Thang Can Không sorry.
Tăng is tăng cân kém.
Yeah, so like increase the scale the least, almost. Yeah. Then for CP or cerebral palsy, we'll say by now, which is like lose brain.
Oh no, right.
But
now.
I don't know why now is brain and not like up.
We had a conversation about this previously.
Yeah.
Now is it refers to what we think of brain. Up is more like not the medical term of the cerebral, of the mass that occupies the stuff in the skull. I think, right? Was that what I kind of remembered? Up would be is less medical.
It's more like food at the food stall.
No, that's spelled differently.
You don't order now. For asthma, we got swing. Bronchiolitis was interesting. Beam tiêu phế quản.
Tiêu is a Chinese Vietnamese word for small. Phế quản is like the little bronchioles, so it's smaller bronchioles is a direct. So viêm tiểu phế quản.
The inflammation of the small bronchioles.
For growing pains, we've got đau đỏ, lún lên.
That's yaw is because yaw lớn lên. So now is pain. Ya is because lớn lên is you're growing up. So I think she did a literal translation.
Like pain due to growing up.
Yeah.
And then if they're Northerners, they might say now gió lon lớn.
Yeah, lớn lên.
But I think the reason why Bác Ann in Vietnam did a direct translation is I think they don't actually use, I think she actually did a literal translation. I don't think they use growing pains as a word. Do you know what I mean? Like it's a North.
It's a medical, it's a North
Yeah.
American, like phrasing. It's a type of phrasing we would use.
Yeah.
It's like croup. They must use another word. There's no way it's like, you have a disease of the upper and lower respiratory tracts. Okay.
For JIA, we have Viêm khúc vị Thien An Nguyen.
Yeah, so that's like arthritis of the adolescent. Is it Tanning? It's Tanning, right? That it would make more sense.
Tanning, I think maybe so Tanning is adolescence. Viêm khúc is arthritis.
Yeah.
For a septic joint, we would say something like khúc thờ huế.
Khúc tự hoại. Khúc is
khúc thờ hoại.
Yeah. Tự hoại. I have never heard that or used that. I would be like, coffee chung trong cái cup. That would be
that's right.
Or like coffee bao vi chung. That's my fancy way, my non-fancy way of saying.
Rebecca, didn't you have that on your slide? Did you have that on your slide, Rebecca, when you did yours?
I'll have to pull it up because I don't remember it. But
Oh no, we have to go back and practice. Hey, yeah, I don't remember seeing that word on yours. I think it was Viêm khúc is the one that you used, I think.
But I think that was like just arthritis in general too.
All right, the MSK one, right. And then Viêm khúc phản ứng. Interesting. Phản ứng.
I don't know.
You know what? Like side effect? Is it phản ứng like side effect?
Yeah. I don't know if she's doing a direct translation of everything. Barney, do you mind if you run some of these through your parents? Hello?
Yeah, you know what? Maybe I'll ask them to see it as well. Reactive arthritis. I feel like that's not the right.
Yeah, because I think she's doing like a direct translation, whereas we have a different meaning for reactive arthritis when we talk about it here.
Yeah. Okay, which is fine. And I'll make it publicly available too. Yeah.
Yeah.
Yeah, and then and it might be on Rebecca's presentation too.
I have for septic joint. I have cup tự hoại.
Oh, you did?
Yeah, I guess.
Oh my gosh! Snap! We didn't learn anything. Oh no!
Hey, this is active learning. Look at this. We all set it up.
Oh my
and
gosh!
Oh dang!
Fail! Oh my gosh! We all failed.
That's fine. Yo, Rebecca, do you remember your source for that?
I don't remember. Yeah, I think I had, I'll try to find it, but I think I did most of my stuff based on like another, source. It wasn't Google.
One of those.
No, it must be right then. No, that's right. Khúc tự hoại. Oh my gosh.
But I mean, in the same way, like septic joint is a technical term, right? Like that's something you're reading in a discharge summary or like a
you wouldn't
physical.
really
it's
be
not
saying
something,
it to a patient.
Yeah. So it's good. We have learned and grown our medical knowledge.
Yep.
I saw that Phil asked a question for tics. I punched the word into Google Translate and it just came up with tics. So I'm not too sure. Sorry, Phil. I don't have an answer for you there. Does anyone know?
No, I don't know.
Tics. But that's a good question.
Okay. Why don't you finish us off here, David?
Yeah, I guess I'm rolling through this a lot faster than I thought I would, which is good, I guess. Can't complain. Speech therapists, thankfully all of the auxiliary staff, it's all structured very similar. So for our speech therapist, you'd have trị liệu bằng lời nói. Lời nói.
Yeah, bằng lời nói.
Bằng lời nói.
Lời nói. So treatment about talking, basically. Treatment about talking. For your physiotherapist, or sorry, occupational therapist, you have trị liệu bằng nghề nghiệp, which almost is like treatment about your job. So this sounds like it might be a literal translation as well. I don't wonder if that was it. And then for our physiotherapist, we would have trị liệu vật lý. Vật lý.
I use that one a lot. Oh wait, you can also go vật lý trị liệu.
Oh, okay. So physical. So then it's like not. It's in the order that we understand it. And then finally for behavioral therapy, we have trị liệu hành vi.
Cool.
I had a question for the group though. I was wondering, as a counselor the same as a psychologist or bakshi tamli? Would you guys say that it's the same thing? It's a question I had for you guys.
I think we had those things sorted out on the previous one about mental health. I've never used the term like directly myself. So you're saying counselor, right? Like kind of like a school counselor sort of thing?
I think when we did it before, Bakshi Tamli is a psychiatrist.
Right.
Because like Chris was alluding to, I was wondering, have they spoken to a counselor at school? Bakshi Tamli ở trường. But I think if you use the word tamli, they'll be like, we don't have a tamli. Bakshi tamli.
Yeah. Interesting. Okay, we can check on that one. Sure, that's cool. Okay, so how do you want to do it, David? Should we save the rest for another day then? Like for part 2, the history template?
Yeah, the history template, I think there's a lot more meat to everything. And right. The history template, I kind of had in mind for next group, the next session, which is we would break into smaller groups.
Sure.
And I think there'd be a lot of more participation between the smaller groups, because I find it's a really good way to synthesize and practice, and everyone can have an opportunity to practice. But I was curious if anybody had thought there was additional terms that could be added, or things that any kind of things that I could look up on your guys' behalf, just to help round out the vocabulary that's needed.
How do you guys like start saying like, oh, you can start introducing solid food now?
Yeah.
So I might say, I'll try my best. But I will say that your guys' Vietnamese is excellent. So I feel like this is the blind leading the people that can see. So, if I was like put in that position, I might say, okay, bây giờ bé uống sữa mẹ, nhưng mà bây giờ mình 6 tháng rồi, có thể mình cho bé ăn mấy đồ ăn mà có cái xác chứ. So có thể mình ăn mấy đồ ăn mà mấy đồ ăn bình thường á, mà đồ ăn cho bé ở 6 tháng.
Yeah, that's good.
That's right. That's good. Yeah.
Anyone else? Any other history questions? I know that this was sometimes requested in our group. If anyone has anything to ask, and then we can kind of bulk out the this document.
There was an error that I wanted to point out as well. Sorry, Chris. In the social delay area, just above global development delay.
Yeah.
I think we'd have to delete the word "je," the first TRE.
Yeah.
And this was a section where the social delay, I actually did have a question just because I wasn't sure how it was, why there was a, when Dr. An put the
slash,
the little thing there, yeah, I wasn't sure what it meant, but I wasn't sure if she meant that a social delay would either be that phrase at the beginning or the second phrase behind the bracket.
Yeah, they kind of mean the same thing. So chậm giao tiếp, that means giao tiếp is like socializing, and chậm is slow, so slow at socializing. Or hòa nhập xã hội is like integration into society, more like on a more, I think she didn't know what you were trying to get at, right? Because maybe in Vietnam they don't differentiate, I don't know.
I would probably then take the first phrase because it seems more economical.
Yeah, and I think it's in keeping with these other ones. Yeah, xã hội is like social, because like social history and stuff, right?
No, hòa nhập xã hội is like people who can't integrate into society properly. Kind of like if, you know, which is not, I think what what you're trying to say here is if the child's having trouble socializing with other people, then it's chậm giao tiếp, right? But the other one that she said about xã hội, không có nhập vào xã hội, is more like when an adult has problems like integrating into society.
Right. And maybe I wonder for you, David, vaccinations, is that something that you have to talk about much with Vietnamese people, or is it pretty low-key?
We do, yeah. I always butcher the word or pronunciation, but I'll say mẹ có chích ngừa đủ
đầy đủ.
Good one, Chris. We don't have to break into small groups.
That's my go-to word. Sorry. Okay, so chích ngừa, yeah. Do you get a lot of pushback, anti-vaccine in your?
No, not at all.
No, zero.
Vietnamese people are all over it. Yeah.
Zero. It's never a Vietnamese person. It's never a Vietnamese person.
Okay.
It's like an anti-stereotype. I don't know. It's a stereotype that you never see a case of it.
Fair enough. Cool.
And how about like kind of like vocal vocabulary and milestones, like, you know, two words togetger, or like
that's actually going to be in our next small groups. We have that. We're going to talk about vocab and 2-word combinations, so to be determined.
Ooh, I think that's a good hook. Okay.
Well, how do you approach, like, when you're doing exam and you're trying to say, okay, I'm going to examine the hips, or there's a problem with the hips, or I'm worried about, like, you know, just hip dysplasia. How do you say that?
I don't know the word for hips, so I'll just say, like, well,
actually, maybe we can look that up maybe for.
Or actually, that kind of works up here too, hey?
And I'll throw this out to Barney. Barney, do you have a lot of parents concerned about head shape, like?
Yep.
Plagiocephaly, and what do you say? I mean, méo cái đầu.
No, I usually say, cái đầu hơi dẹp chút xíu ngoài sao.
That's right. So
it's a little bit flat, but then I usually just explain to them, yeah, hơi dẹp thôi, nhưng mà hay là dẹp hơi nhiều, nhưng mà cái mặt thì chưa đến nỗi mà nó
méo.
Nó méo, yeah, that's right. Nó không có méo, so cũng okay. Chỉ cái gắng đừng có nằm ngửa, which is like ban ngày á, đừng có nằm ngửa nhiều quá. So during the day, try not to let the baby lay on.
That's a good one. Yeah, đừng có để nằm ngửa, nằm sấp. Nằm sấp is on your tummy.
Yeah, on your tummy. So cho nó nằm sấp càng nhiều càng tốt ban ngày á. You know, khi mà ngủ thì cần phải nằm ngửa, nhưng mà ban ngày gắng cho nó nằm sấp nhiều hơn, tập cho nó quen á. Yeah, I just say that.
So sap is which one? Nam sap
is on their tummy. Yeah. So
okay. So that's
for tummy time. You just cho em bé
tummy time
is like tummy time.
SAP.
Yeah.
And Barney, what's the difference in yep and sap? Yep, and sep.
Yep is flat. Sep is
Deflated.
Deflated. Yeah, that's right.
Oh yeah. Sep. It's something that, yeah, I guess like a flat balloon or something, I suppose. So I usually say yep. Đau hơi yep. Yeah.
Oh yes, we can throw this all out there. How about the fontanelle?
Oh, I guess we wouldn't. I guess we would not say sep, but
Yeah.
How do you say fontanelle? I don't know.
I'm gonna go here. It says here, top juk. Top juk. Top juk.
Thanks, Google.
I
feel like we need to say like cái chỗ ở giữa trong cái xương or something like that. A trước and a sao. There you go. Anterior and posterior.
You know what? I don't. Would you ever say something like this? Cái lỗ trong cái đầu hơi lớn, cái lỗ trong cái đầu không có chưa đấm. I don't know.
No, there's a word for it. I just forgot it.
Yeah.
I've heard people say it. I just forgot the term for now.
And I wonder if I looked it up when I did the newborn check.
It's something mem. I forgot.
Okay. Cool.
Yeah, I think I know what you mean. I just can't remember it either. Oh, shoot.
Okay. Well, how about we'll leave it at that. Thank you so much, David, for doing this. And then we'll have a chance to kind of go back through. And so maybe next time we'll have an intro or like a review of this and then an intro into the next session. And then that just gives us more phrasing to start practicing because, yeah, these are all people and Vietnamese people have babies and kids, and we need to ask them about things for their health. So thank you so much for contributing these things to help us get all the words. We really appreciate it.